It's a good transition from, love bereaved families who need grief support.
Right.
And I've already many of the families during their crises, and for them to transition into the grief group has worked out very well.
Yeah, especially when patients die at the hospital,
Yes, yes.
which so many people do.
Yes,
You know,
yes.
some people prefer to die at home, but
yeah.
most people die in a hospital or in a facility of some kind.
Yes, I would say about half of our grief group participants have had loved ones that passed away at the hospital.
In the hospital,
Yeah.
yeah. They also have another grief group out here over at the Santa Cruz Valley Senior Center. And I've been going to that one. And it's so interesting meeting all the people there
Yes.
and listening to what they have gone through
Yes.
and how their week is, because this is once a week. And you learn so much, and you can identify with so many of them because you've gone through the same thing, you
Right,
know.
right.
And it's a very, very comfortable group, as I'm sure it is at the hospital.
Yes, the participants, many of them return every week. It's an open group, so they don't have to commit, but we have seen many return, averaging about 12 to 15 bi-weekly. So it's a good core group, and a lot of them find comfort in sharing the same stories, knowing that they are not alone.
Absolutely. That
Yeah.
makes all the difference in the world. It really does.
Yeah,
It's
and all
amazing.
of them are on different stages of grief. For example, we had a new participant, and her husband just passed away, and she's fully displaying, one of the stages, which is anger, which is normal.
Yes,
And,
that's part of it.
And for her to listen to the other participants, it's helpful for her to know that she's not stuck in that one stage. That there is
Yeah.
hope.
That's right. That
Yeah.
you do go through a anger state, a depressed state, just a nothing state.
Right.
You go through all of those areas, and from what I've understood, it takes a good 2 years to go through all the processes that occur after losing a loved one.
Yes, yes, and one of the things that I emphasize, and a lot of the participants have experienced, is that grief is not something that we get over with. We befriend grief for the rest of our lives when we lose
Absolutely.
someone.
Absolutely.
And there's some good days, there's some bad days.
We're talking with Ben, who's the supervisor of chaplain services at Henry Mayo, part of the grief group that we're discussing this morning. And then also sitting next to Ben is Patrick Moody, who's the director of marketing and PR relations community benefit at Henry Mayo. Gentlemen, can we talk about what I might see if I choose that I want to join the grief group? Am I going to be required to, share my story, or is it something that I can just kind of come in and take in what's going on around me? Am I expected to kind of, put myself out there, make friends, or am I just able to experience it at first?
Yeah. So Patrick handles that part of advertising on social media, which he has been putting out, and that's where we get most of our referrals. And participants do have to call our office, that's 661-200-1125, to register. And they come, it's an open group. They do not, and we emphasize at the first call when we speak with them that they can speak or they don't have to speak. And we've seen that happen.
Do you find that helps just for someone to maybe hear that someone else is going through something similar? They can just kind of feel like they're in the same boat.
Yes, exactly. Yeah, we do have a lot of our participants who just listen and later on, engage in conversation in the next meeting, and so forth. Yeah.
Yeah. Patrick, did you have anything that you wanted to add?
Well, just I think Ben would reinforce this. One of the features of grief is I think it's experienced it's not experienced the same by any two people. Each one experience is different. So
Exactly.
as far as I know, our grief support group, which you know more about than I do, welcomes anyone wherever they are in that journey and,
Yes.
and how they're experiencing grief, because it
Yes.
is different for each person.
Yes, yes, yeah. We have participants that have lost their loved ones maybe a week or two, and others who have been coming for this last 12 months, 3 years of walking with grief. So
And how long is each session?
the sessions is offered bi-weekly. Our next session is going to be May 19th, and it starts from 3:30 to 4:30. So it's an hour long.
Okay. And when I go to register, I know you mentioned the phone number, 661-200-1125. I was kind of looking a little bit online as well. Am I able to register online, or is it solely
No,
via
not
phone?
not online.
Okay.
Yeah, via
But
phone.
you can get information in terms of
Online.
location and that type
Yes,
of thing. Okay.
exactly.
And that's henrymayo.com.
Right.
Beautiful. Can you talk a little bit about, I find it interesting, I appreciate that it's not just for someone who is newly going through a loss. I like that you're open to those who have been experiencing a loss for quite some time. Like you were talking about, 2 years is kind of an average of a grief, stage, but I can come back, kind of come and go as I please. Maybe I'm just having a really bad week. Maybe it's, something that reminds me of my loved one and I can pop in. I like that that's open to people like that.
Yes, yeah. It's very open.
Yeah, well, I was going to say, I also lost a son in 1985. And in the Signal, a couple of days ago, they had an article about a young man who lives in, is it Agua Dulce, who just raced the Dakar race in Chile. And my son was the first American to race the Paris Dakar race from the Eiffel Tower down through India over to Dakar. I mean, yeah, that's right. And it was 6,200 miles. And he came in fourth place,
Jeez.
fourth overall.
That's impressive.
But it's interesting when you talk about grief, because I still grieve for my son.
Of course.
I think losing a son is, in my opinion, the worst loss. Or losing a child is the worst loss you can experience,
Yeah.
because you've given birth, and you've raised him or her, and then to have him all of a sudden or her leave, and pass away. And he passed away from AIDS. He got it, he was injured, got a blood transfusion, and the blood was tainted. That was the same time Rock Hudson died. That's when my son died. And it was from tainted blood. But nobody knew anything then.
Right.
You
Yeah,
know?
the 80s.
They didn't know what
no.
it was all
Yeah.
about. But no, you can still grieve no matter. And I lost my husband almost 6 years ago, and I sit in his chair, and I look up at the mantelpiece, and I have him displayed. That's his place in our house, and I look at him every day, So there are things that you can do to keep them more alive,
Yes.
and it kind of helps going through the grieving process.
Yes. Yeah.
At least it's helped me, and I'm sure it's helped a lot of the patients that you see.
Yes. Well, one of the things that I noticed in our groups is the silence in the evening when they're by themselves. So coming to a grief group is very helpful.
Oh yes.
Having some people or friends to interact with.
So can I ask a question?
Yeah, please.
I'm going to ask Ben a question.
Yes, you can, sir.
So Barbara brings up an interesting point, and I just wonder how you counsel people about how there might be unexpected events that come up that remind you of a loved one. Like there's this article in the Signal that her son's been gone for some time. How do you counsel people to deal with those kinds of things? Because it must happen a lot.
Yes, yes, it does. I encourage people to lean into their emotions rather than pushing away from it, to lean into it and follow your emotions, in a healthy way. And in our group, they're able to bring that up and talk about what they're feeling when something triggers them, which is a common.
And
Common
it
thing.
also helps to cry.
Yes, yes.
It really does. I think you should not stop yourself from crying
Yeah,
because you're not being silly,
yeah, that's true.
It's I think it's a very important part of grieving
Yeah, absolutely.
because it releases whatever's in your body and in your mind, and I think it helps you. It really does.
Yeah.
I know it's helped me tremendously.
Yeah. Well, they talk about the stages of grief.
Yes.
Right.
Anger, like you
Anger.
mentioned before, Ben, and obviously sadness. I would assume maybe confusion too. It doesn't feel real. How did you get to this point?
Right.
This person that I love and care for was fine, a few months ago or
Right.
a few years ago even, and this kind of just all of a sudden is forced upon you. How do you deal with that every day? I do like the fact that everyone has friends and family to talk to, but then again, maybe they don't. Maybe this person is in a situation where
Exactly.
they don't have someone that, hey, come over and we'll have lunch and you can talk about your loved one. And I think it's also important to have someone who's kind of neutral, for lack of a better word, and they could be a little more of a sounding board.
Right.
Because quite possibly maybe your friend or your neighbor is also grieving with you. So
Right,
it's good to
yeah.
have someone who is able to just kind of hear you and be there for you and not necessarily give you advice or give you, the next step of what to do.
Right. Yeah, and that's how I lead our group, not my group, but the hospital grief group. I rarely teach. I tell them that this is participant led, and an hour feels long, but it goes really quickly because the participants will bring up a topic and then everyone else chimes in. So it goes naturally organic with everyone. The emphasis here is for them to just bring out and share their emotions and have other people share. Well, I experienced a similar situation, and this is how I handle it. So the group is neutral, which is great. Everyone is very compassionate, active listening, and encouraging.
They've all gone through a very similar situation.
Going through it, yes.
And that makes all the difference in the world. It really does.
Yes, yes, yeah.
To have someone in there who has not lost a loved one, I think they kind of appear to stand back.
Mm-hmm.
They don't get involved, with the people in the group.
Yeah, yeah.
And it really helps. But yet it also hurts because you go through those same feelings that you had when it happened.
Right, exactly.
Well, and that kind of makes me think about, the fact that Patrick, you're kind of giving people a space to come to the hospital, most likely the scene of where they did lose their loved one, and in inviting them into the hospital, because this takes place on campus, on the hospital campus at Henry Mayo, you're kind of taking, and for lack of a better phrase, you're taking that edge off a little bit, I think, kind of, we had this awful thing happen, come to us here and we can kind of, go through it together with you and maybe kind of help them. Because I would imagine that it's traumatic, obviously, to be back in that space. So I think it's important that it is on campus, again, where you were.
Yeah.
To kind of break that up a little bit.
You also supply hospice, don't you?
Yeah, I was going to ask Ben maybe to talk a little bit about the support we give to patients and families at end of life.
Yeah.
Yes, yes. So our spiritual care department, we have a couple of chaplains and we have 10 spiritual care volunteers who all respond to situations. When it comes to end of life, we do have our staff chaplains respond to those
I
specifically.
know that happened when my husband was there.
Yes.
My
yes.
husband was in the hospital here 5 weeks,
Right. Right.
and
yeah.
toward the end, the doctor called
Yes.
the hospice. in
Yes,
there.
when a patient transitions to comfort care, our reporting system triggers the chaplain's office, so we respond to that immediately. And because we know it's comfort care transition, for example, I brought a candle here, and I give it to families.
Yes.
Did you get one of these?
Yes, I
Yes,
did.
yes,
I
and-
still have it.
Oh, you
It
do?
doesn't work anymore, but I still have it.
Come back to the house. I'll give this to you afterwards. How about
Oh,
that?
all right. Thank you.
Yeah, yeah. So just telling them that, that their life was a light or is a light, and to keep their memories alive. And we help them through that. It's those anticipatory grief, of losing their loved ones that's imminent.
And yeah, it's going to happen.
They know, yes, it's going to
know-
happen, but yet it still comes as a shock.
That's right. It absolutely
Right,
does.
yes,
It
sadly.
absolutely does.
Yeah.
And these grief groups are free for people to join. And like you said, just go, you can find more information on their website, henrymayo.com, but call them in order to register yourself, 661-200-1125.
That's correct.
But free otherwise.
Free
And
otherwise, yeah.
and that meets. Can you tell again how often they meet and what time?
Yes, so the grief group meets bi-weekly. The next meeting is May 19th. I believe the schedule is also on the website. And it meets from 3:30 to 4:30. And it
And-
lasts exactly 1 hour.
It's every other Wednesday.
Every other Monday.
Every other Monday. Sorry.
Monday.
Yes, every
Yeah.
other Monday. Yeah.
Are there other resources that you offer? Or is it strictly just the in-person, like pamphlets, brochures, that type of thing, something tangible?
Yes, so yes, the grief group is a primary resource that we have. I do encourage participants to give me a call if they need extra support between the the sessions. So I've had calls from participants to just provide a listening ear, spiritual support for them.
And that's so important.
Yeah.
It really is.
Yeah.
Yeah.
Well,
Very
we've been talking with Ben, who's the supervisor of chaplain services at Henry Mayo, and it's part of the grief group there that we're talking about. Also speaking with Patrick Moody, and Patrick is the director of marketing and public relations community benefit through Henry Mayo Newhall Hospital. Gentlemen, we appreciate your time this afternoon. One more time, what's the best way to get a hold of you at Henry Mayo if I choose to want to participate in the grief group, or really any other services that you might offer at Henry Mayo?
Yes, call the chaplain's office at 661-200-1125.
Beautiful. All right. Thank you for joining us this
Thank you.
afternoon.
Yes,
And
thank you,
you've been
gentlemen.
listening to the Senior Hour on your hometown station, 98.1 FM, AM 1220, KHTS.
Welcome back to the Senior Hour. I'm Barbara Cochran with my co-host,
Jen Sparks.
Jen Spark, on your hometown station, 98.1 FM, AM 1220, KHTS. And our next guest now is Dr. Caitlin Gomez from the City of Hope, and she's a radiation oncologist. But we're not talking about that today. We're talking, well, a little bit, but mostly osteoarthritis.
Yeah, so I'm a radiation oncologist, as you mentioned, with City of Hope here in the Santa Clarita area. And I did my training at UCLA, medical school and residency, but I've been here in the Santa Clarita Valley for about 10 years.
Oh.
And so mostly I treat cancer. That's what we often use radiation for, therapeutic radiation.
I didn't use it. I've beaten cancer twice.
Very
And
good.
it wasn't radiation, but it was chemotherapy, which caused this mess on my face.
Gotcha.
Chemotherapy.
Yeah, so it depends. It depends on the type of cancer, but generally we treat cancers. But nowadays we're actually offering radiation treatments also for osteoarthritis, which is something that's relatively newly come up in our field. It used to actually be a very commonly used treatment back several decades ago. But more recently, it had stopped for a few decades because there was a trial that kind of questioned whether there was actually a benefit to radiation for osteoarthritis.
Well, so what is osteoarthritis?
It's basically an inflammation of the joint. I mean, some think of it as more kind of mechanical wear and tear on your joints, different from rheumatoid arthritis. Yeah, sometimes there can be some just physical changes that you see.
Yes.
But it can be diagnosed with having, a long-term pain in a joint in someone that's over 65 if there's less than an hour of morning stiffness. Because if you get longer times of morning stiffness, then we're more thinking about something like rheumatoid arthritis, which is more of an inflammatory condition where your body is kind of attacking the joints.
This is psoriatic arthritis.
Gotcha. Yeah, so that's another inflammatory arthritis. Osteoarthritis is generally your kind of run-of-the-mill arthritis that, a good portion of the population has as we get older and have, wear and tear on the joints.
And it's interesting, my arthritis mainly just affected my hands and
gotcha.
my arms.
Yeah, yeah.
I didn't have pain anywhere else,
Well, that's
but,
good.
yeah,
But it's tough in the hands. Those are
yes, because
needing
it was
those all the
hard.
time.
It was hard for me to use my hands
Yeah.
because it was painful. And of course now I have neuropathy, which I'm fighting. But that's all right. I got rid of it once. I'll get
Yeah.
rid of it again.
fair enough.
Dr. Gomez, can you talk a little bit specifically about the treatment? I know you had mentioned radiation. Is it only radiation that will treat osteoarthritis?
No, there's a lot of treatments for osteoarthritis. Generally, we would start with medications, like Tylenol or ibuprofen. We try to stay away from Advil or ibuprofen if we can, because it can be hard on the stomach, hard on the kidneys if you're taking it in the long term. So usually more Tylenol, but also physical therapy. But if things aren't working that are a little more conservative, like physical therapy or medications, it can be moving into other treatments like joint injections or needing, a joint replacement, like a knee replacement, hip replacement. So that's where radiation can really kind of come in. If you're at the point where the more conservative therapies are not really working anymore, or not controlling things, and certainly a painful joint can really affect your quality of life, and they're starting to think about, something more surgical or more invasive, then, radiation's a good option to consider. So it's 6 treatments.
What is radiation?
Radiation is X-rays, essentially. So they're high energy X-rays that come out of a radiation treatment machine. It's a machine that, our machine up here in Santa Clarita looks similar to a CT scanner if you've ever had a CT. But it's similar X-rays to getting a chest X-ray or a mammogram or dental X-rays. They're just much higher energy. So they're more directed at where we plan for them to go, and they deposit some radiation dose there, as that's what we
That's
aim to do
interesting.
with them.
Is it associated with MRIs and CT scans?
MRI is a little bit different because that uses magnets to generate the signals that we then take in and read as images. But CT scans are also X-rays. They're just a different energy there. But it's similar to getting a scan in that when you get a radiation treatment, you don't see or feel anything. It's not painful to have a radiation treatment. And when we do treatment for osteoarthritis, we're using actually very low dose radiation. So usually when we do cancer treatments, we use much higher doses, and the potential side effects of treatment is that it can cause inflammation in the area that causes the side effects related to where we're treating. But when we do treatment for osteoarthritis, these very, very low doses actually are anti-inflammatory, which seems kind of tough to understand there, but it's sort of this paradoxical thing that high doses cause inflammation and very low doses decrease inflammation. So that's how we think that it actually helps with the arthritis, is decreasing the inflammation in the joint.
So Dr. Gomez, let's say that, a friend of mine or myself or whoever is diagnosed with osteoarthritis, do I just come to you, or do I need to be referred to you by another doctor? How does that work? How do I end up at your doorstep?
Yeah, either way, you can just call us and make an appointment, or you might have a doctor that brings it up and refers you. So either way.
And what's the best
it's
way to
fine.
get a hold of you at City of Hope?
Just give us a call at our office. So 661-259-2990. We're located right on the corner of McBean and Valencia. In the Providence building over
Beautiful.
there.
And I was doing a little bit of research prior to you coming on with us this afternoon. We're speaking with Dr. Caitlin Gomez at City of Hope, talking specifically about osteoarthritis treatments, but City of Hope focuses on cancer treatments as well. I thought there was some kind of like a program to kind of assist people just with their emotional state. Is that what I was reading too a little bit online?
We do now have a psychiatrist that is coming to our City of Hope multi-specialty clinic. So radiation is a separate office, but in the other office, we do now have those services available right here locally to assist patients that are having difficulty dealing with the emotional side, of a cancer diagnosis.
That's great that people can go there and have it be more encompassing, not just, oh gosh, I got to go to a doctor's office. At least, they feel like they have someone that they can talk to there and also have their treatments done at the same time. And you kind of have opened that door for people to be a little bit more welcoming. And I think that's important.
Yeah, we're really excited about having that available. Yeah.
And do you also allow family members to come in with the patient?
During the radiation treatment or just in general?
Well, in both areas.
Well, for the actual treatments themselves, whoever is getting treated would have to be in the radiation room by themselves. I mean, radiation is very directed, but we do absolutely everything to minimize, any, a dose going to anyone else. So they're in a special shielded room. But other than that, family members are absolutely, welcome in the clinic for consultations. When we have on a visit while we're on treatment and checking how they're doing, family members are invited to join in there. Follow-up visits, of course. They can wait with them, while they're waiting to get their treatment. So, it's pretty open door in terms of that.
That's good.
Yeah.
That's good because I, either my son or my daughter or my granddaughter will take me, because I basically don't drive anymore.
Gotcha.
Happens as you get older. And I'm getting older. Not old, but older. I refuse to call myself old. No,
Dr. Gomez, can you talk a little bit about, I'm kind of peeking at your website here, and this is a pretty impressive resume in terms of what City of Hope offers. It was named by U.S. News and World Report's 2024-2025 rankings as a top 5 hospital for cancer in the United States, the highest such ranking in California. So you know that you're in great hands when you walk into City of Hope. You have people who have the experience and who have that bedside manner. Like I said, pretty impressive resume with you and your colleagues.
True. That's what I've heard for years about City of Hope. I don't think I've ever heard anything bad about City of Hope in general, treatment and all kinds of things. Yeah, it's you. How long have you been around?
Well, I mean, City of Hope has been around a very long time, but it branched out into the community here in 2018. So it's been like 7 years that it's actually been.
Hasn't been here very long then, has it?
Well, that's with radiation. Actually, I think it was a little bit before that for medical oncology, but certainly we're part of a much wider network that offers, full range of cancer services, all the way down to, stem cell transplants and CAR T cells and various, more leading edge clinical trials and things like that.
Now, so are you all over the United States, or are you on the West Coast, or?
A good question. Yeah, City of Hope actually initially started here with the Duarte campus,
Yes.
but now they've opened an additional kind of a second main campus down in Irvine that has a new hospital going in and all services down there. We have multiple satellite clinics throughout the Southern California area, but it's recently also branched out and taken over some of the cancer centers of America. So City of Hope is now a more
beginning-
national organization
Right.
in Chicago, Atlanta, and Phoenix, as well. So
Well, that's good because
Yeah.
you do have a well-known organization, and it's considered top quality. That's what I've heard from City of Hope, and it's good that you're branching out and getting more well known.
yeah, well, the goal is to really make all of these kind of leading edge clinical trials available, more widely,
And there
across
are
the
more
country.
clinical trials in all kinds of areas and diseases that are coming up.
Yeah, always stuff in progress.
Beginning to find out a lot more about a lot more diseases, other than just oncology.
Yeah.
It's becoming very well known.
Yeah, the technology is advancing quicker than we can keep up with it, I'm sure.
Yeah, it's
Do you-
unbelievable.
Do you find that sometimes it's like something new comes along so quickly and you're like, wow, okay, let's figure out how this can help our patients?
Yeah, I think things are always changing. I think probably one of the areas we've seen the most change in recently is breast cancer, just in shortening courses for patients. I mean, it used to be that we would do just standardly 6 weeks of radiation, and that was that. There was no kind of question around it. And then trials came out saying, well, 3 weeks is the same as 6. And so that has become basically the new standard for treatment, but even shorter than that. We can do it in a week. We can just do part of the breast, and these things have less and less side effects associated with them. They're faster, easier, more convenient for patients. Doing treatments like holding your breath to keep the heart away from where we're treating the breast, or treating you on your stomach so we have the breast hanging away, and all these are ways that we're trying to reduce dose to the heart, really reduce the long-term side effects of radiation. And a lot of that has been just evolving over the last, many years, several.
Well, a lot of these treatments are good for the body, but they're also bad for the body.
It's always a balance. Yeah, absolutely.
It's always something that you have to balance.
Yeah. I mean, not so much with the osteoarthritis treatments. That's the one kind of, because it's so low dose, there's pretty much no side effects associated with
Right.
it. They haven't published any cases of like causing a cancer from radiation for arthritis. Usually it's done in an older population and, somewhere further away, like the knee or something like
Yeah,
that.
well,
But
it's interesting because I was having pain in my hands and my fingers, and the doctor put me on methotrexate. And the methotrexate, finally, the oncologist at UCLA said that was quite possibly what caused my cancer. And I've been hearing words to that effect also, that there is a possibility that methotrexate caused the cancer. That's something else that, and I only got the cancer or realized I had it after they quit making methotrexate for a while. And I started having indigestion, which I've never ever had. And I thought, well, maybe I better go see a doctor. And he did either an MRI or a CAT scan and told me that's what it was and referred me to UCLA. Dr. Black. And so, but I think they've taken methotrexate off the market.
oh no, it's still in
No,
use.
it's still in use, is it?
Yeah, kind of any of the.
But now they give the possible after effects too, don't they?
Well, I mean, with any cancer treatment, certainly when I see my patients, we have a extensive discussion of
Right.
all the possible
All the
things
possible
that
things.
we can think of that could happen, trying to
well,
make sure you can have a
this
well-informed
was given
decision.
to me for my arthritis.
Yeah, it's still in use for rheumatoid arthritis for sure. Yeah, but any of the treatments that kind of lower your immune system can potentially have like some risk
Yeah,
of causing
yes.
a cancer. Yeah,
And,
some of the biologics and things.
But it's amazing how our medical system has improved over the years to assess so many patients with so many problems. It's just amazing.
Well, yeah, look what we're talking about now,
Yes.
the radiation with osteoarthritis. Prior to this interview, I would not have guessed that was
No.
something that would have been a
at all.
possibility. I thought, okay, that's just cancer. Speaking of, is there anything else besides osteoarthritis and cancer that you use radiation for, or is it just those two things? For now,
there's,
until
some benign tumors that we treat,
Yeah.
like brain tumors that are not necessarily a cancer, but if they're kind of a local problem, like a meningioma, if that's growing, or there's like benign ones that can happen in the inner, like the nerves that lead to the ear. So we'll treat things like that. Sometimes there's some various other things that we treat rarely, like a Dupuytren's contracture or something, like having some scar tissue in the hand that causes fingers to be down, or keloids. That's another one.
Oh, okay.
So some people just get like a pretty big scar when they get an injury, but a keloid would be like a really big scar that's kind of like almost like a mass on the skin sometimes it can be painful or itchy, and they're kind of pulling at the skin there. So for that, we would remove that and then do a few treatments of radiation afterwards to prevent it from coming back.
Okay. Well, we're talking with Dr. Caitlin Gomez at City of Hope, and we'll return with Dr. Gomez and we'll talk to a few more aspects about treating osteoarthritis via radiation. Again, Dr. Caitlin Gomez with City of Hope. And we will be back here on your hometown station, 98.1 AM, 1220 KHTS.
Welcome back to the Senior Hour. I'm Barbara Cochran with my co-host
Jen Sparks.
on your hometown station, 98.1 FM, AM 1220 KHTS. And we're speaking with Dr. Caitlin Gomez of the City of Hope. And Dr. Gomez, what got you started in this business?
In radiation oncology. Well, radiation is actually not a very well-known specialty among medicine. So when I had initially launched into my medical school career, it was not at all on my radar. It was not something I was thinking about, but I found it along the way, and I just really enjoyed the combination of the things that we do. So it involves a lot of patient contact, patient care, and kind of educating patients, as well as longitudinal care, so taking care of their cancer, but then also following afterwards and being able to have that relationship with them and see how they're, doing in the long run. But it's also very technical, so it involves reading imaging, knowing where the cancer is, designing radiation plans, and what we're going to treat, what we're going to avoid, what doses can go where with the radiation, so that we can
That
really-
sounds like one heck of a lot.
Well, it's interesting, but it's also very gratifying, I would say. So
Do family members of yours, are they doctors, nurses,
Nope.
anything like that?
No, I'm the first doctor in my family.
So what happened to make you decide
Yeah.
to go?
it was
to be a
actually my
doctor?
high school physiology class.
Really?
So yeah, I had a really great high school physiology teacher. We actually had a cadaver in our high school class out in Agora Hills, and that was it. I just thought it was so interesting, so fascinating. So from there, continuing
so that's
on.
what got you going.
Yeah.
I want to pivot a little tiny bit. We only have a few moments left in our show this afternoon. Dr. Gomez, can you talk about, obviously, once somebody has osteoarthritis, there they are, they can come see you at City of Hope. Are there any preventative means that someone can take to maybe not have to see you as quickly?
Good question. I mean, in general, osteoarthritis is kind of wear and tear on the joints. So you're at risk if you're doing like a lot of heavy duty exercise, sports, things like that. But a lot of
Yeah.
that is just life, unfortunately.
And
so,
that's tricky because you want people to still move and be active.
Absolutely.
But too much of a good thing maybe
Yeah.
might overdo it.
Maybe. But yeah, I would still strongly encourage exercise. I think it's the number one thing you can do for yourself to
Is
help
it,
prevent cancers.
Is it genetic?
Not clearly.
The osteoarthritis. I mean.
Yeah. No, I don't think there's a clear genetic component to it. So just, something that can happen as we use our machines.
Yeah. And your food necessarily might not, what you're eating might not play into it either.
Not really.
Yeah.
Yeah, I mean, I get a lot of those questions, regarding cancer. Is cancer eating sugar? Should we avoid sugar in our diet completely, if we have a cancer diagnosis?
Right.
But not really, not clearly. I mean, sugar is just a food source in the body, and your body, needs it to survive. So avoiding sugar is not going to stop your cancer from growing, or if you're eating it, it's not going to make it grow more.
It's not going to make it worse.
Yeah.
Yeah.
Now, when you go through radiation treatment, does that cause you to lose your appetite?
Depends on where we're treating. So everything's related to where we treat. So if we're treating in stomach area or around the bowels, you could have decreased appetite or nausea with treatment. But if we're treating like the breast, we don't expect it. If we're doing osteoarthritis treatment, we don't expect it. So it just depends.
It's interesting because I lost my appetite.
Yeah, that can happen a
mean,
lot with chemo. Yeah.
It was unbelievable.
Yeah.
Well, we want to say thank you to Dr. Caitlin Gomez for joining us this afternoon. Dr. Gomez is affiliated with City of Hope, usually for cancer treatments, but also talking about osteoarthritis treatments as well through radiation. You can find City of Hope at 661-259-2990. And you've been listening to the Senior Hour on your hometown station, 98.1 AM, 1220 KHTS. We're sponsored by Comfort Keepers In-Home Care and Providence Holy Cross Medical Center. Now go out and enhance your quality of life.